Hi, welcome again to the Adoption and Fostering podcast. And this is the introduction to the July issue of the journal, volume 47, issue 2, out very recently, out now. I'm Vicky, the production editor of the journal, and I'm here with Dennis, who is our editor-in-chief. So we're just going to do a quick kind of run through the table of contents, basically, of the issue, just a sort of brief run through what's in there to give you an idea of what we've published this time. But we're going to start, Dennis. I'd like to ask you about your editorial. So this was sort of inspired by Mental Health Awareness Week, wasn't it, your editorial this time?
Yes. So because we did a little video in light of Mental Health Awareness Week, which you can find on our resource webpage.
On the core of our website, yeah.
Product placement here, some shameless product placement. And in light of that, I thought I would reflect a little bit on the mental health needs of kind of children within the care experience, within the care system, or care experience young people. And I think obviously there's a little risk of maybe preaching to the choir for the people reading it, but I think it's a topic we need to go on about until something changes. So I think the louder we are, the better. And in there, I'm citing, for instance, a recent systematic review that kind of summarized the evidence for mental health needs of children in foster care, and about at least a third have kind of a diagnosed mental health problem, but actually the numbers reported in the review range up to 80%. So it just shows the massive need for mental health interventions. And I think the term that keeps kind of resonating with me the past couple of weeks that a colleague of mine mentioned is missed opportunities, that we kind of often miss opportunities for early intervention and kind of until, these children develop to adults, and then suddenly they might have very severe mental health problems, but there might have been opportunities to intervene way before that. So I think based on that, I think I tried to make two kind of policy recommendations, and one of the recommendations is that we need a routine screening for mental health problems, and also new developmental diagnosis in children for children in care. And I think the other recommendation is to address factors that are associated with those mental health needs, which often is kind of adversity, particularly childhood maltreatment, and kind of 2/3 of the children, for instance, in the English care system, experience maltreatment before entering care. So I think those are the two kind of important steps: reducing adversity or implementing interventions that do, and kind of introducing routine mental health screenings. And I think I in there cite one qualitative study from Adoption and Fostering by Coulter et al. 2022, and there's one quote from a young adult, and he said, he or she, I don't actually know, they said, I just think little kids in foster care, they shouldn't have to ask, can I have help? They should be asked, do you want help? I think it should be one of the first questions, like we shouldn't have to come forward and say it. So, and I think that's kind of one of the inspiration for it, that we need to provide those screenings no matter what, because of the risk factors these children experienced. And if we can catch symptoms early, we can potentially kind of prevent more severe presentations going forward.
Yeah, I guess to put it in a glib way, sort of a proactive rather than reactive approach when it kind of gets a bit too late. Well, it was never too late, but obviously, as you say, the earlier the better, just to make people's quality of lives and sense of well-being better.
Yeah, and these children have been thrown in a situation was none of their fault, right? And so I think as a kind of society, we owe it to them to do the best we can to support their mental health.
And in your introduction to the issue, in your editorial, you think about kind of how these issues relate to the content that we've published, don't you? The articles that we've got published in the July issue, which I guess comes down to the mental health of children in care and adopted children, but also a little bit wider than that, isn't it? These kind of wider networks, the people kind of who
Yes.
look after children in care and their mental health as well.
Yeah, so in a way, coincidentally, the majority of the articles in that issue have a link to either mental health or well-being of either
Mm,
young people or the people who kind of care for them. And I think, again, we have some articles that kind of predominantly listen to the voices of care experienced people, which is always important.
yes.
And there's this very large study from Julie Selwyn and Shirley Lewis,
Yeah.
and we're gonna make a podcast with them. So watch this space.
Yeah.
In their article, they use data from over 9,000 children in care from the Your Life, Your Care wellbeing surveys. And they looked at kind of contact arrangement and the young people's and how happy children were with contact arrangement. And while it kind of supports some previous finding, it also challenges some other findings on the topic. It's a really fascinating article, and I kind of don't want to spoil it by giving it away. So
Yeah, it's definitely worth a read. The findings in there are really interesting. And one thing I will say as a little tidbit is that it doesn't just have to be about people. I mean, I think siblings come across as really important in terms of contact in the articles. So if that's something that people are interested in, I think that's worth looking at. But also pets, which we're seeing a number of articles on that kind of topic, aren't we, of the importance of pets actually and what they offer to children in care. But yeah, brilliant. So that I think it's a collaboration between Quorum Voice and the Reese Centre at Oxford, the Bright Spots programme that these surveys have come out of. But there's a huge amount of data there. So yeah, it's a really important study.
and then we have a study from two PhD students. It's
Mm,
always nice to get articles from kind of early career researcher.
absolutely.
I apologize for my poor pronunciation of their names, Anurina Svenlin and Tina Letter-Lunden. And they also foreground the children's views, and they kind of aimed to develop a child-centered program theory of a respite care intervention in Finland. So respite care is where children basically go away for a weekend, spend it with another family, and do activities within their family. So they experience something else, and then their carers, which are often or parents who are often in difficult situations, also, can look after their own well-being, and the family looks after their child's well-being. Yeah, so very interesting study. And we have a third article, kind of which looked at kind of children's voices, from Sarah Lloyd, where she introduced the building underdeveloped sensory motor systems, or in short, BUS model. And that model, she kind of explores the link between caregiving experience or positive caregiving experience and motor development. So it's kind of all focused on the kind of motor development of young people. And we had Sarah last week, I think,
Yeah, yeah.
for podcast. So if you want to know all about it, you can find it on our resource webpage.
Yeah, that'll be another episode coming out soon. We had a really lovely interview with Sarah, and yeah, it's just so fascinating to think about the effects of early adversity on bodily regulation and how that in turn affects a sense of well-being, and confidence in the world and social kind of interactions that kids have with one another. So lots of examples in the article, but also in our interview that's coming up on there of kind of the children that this model, the BUS model, has helped, which is really lovely. And the next article this is a service evaluation, Jonah Gosling and Jack Purrington, which is about the children in care consultation model that went remote basically during the COVID-19 pandemic, as a lot of other services did. It's quite topical for us because we have lots of product placement, as you put it, Dennis, in this one. But we have a special issue on the digital turn in child and family social work coming in October. And this is a kind of precursor to that, because it's dealing with these issues, isn't it, of remote delivery of services. And again, it's the experiences of those using the services, isn't it, that come through in the article. So they interviewed foster carers to kind of understand how it worked really when it was delivered remotely.
Yes, and then the kind of other study we have on foster carers is a study from Australia led by Mia Gowan and colleagues, and that focus on facilitators and barriers to good self-care of foster carers, so also linked to kind of mental health and well-being. And then the final study, which is maybe not directly linked to mental health and well-being, is a qualitative study by Claire Palmer and colleagues, which looked at the motivations of parents to adopt older children. So it's kind of all interviews with parents who adopted a child who was at least 4 years old at the time of placement.
And it's a really fascinating article that, again, it looks at those kind of views, doesn't it, of the people at the front and centre of these particular issues, and what motivated them to adopt these children and how they had to be flexible in terms of their really what they wanted to get out of the experience to build a family. And then we have the legal note in the issue as well. So we've got legal notes for England and Wales and Northern Ireland. There weren't any relevant cases for Scotland this time, unfortunately. But some really interesting content there in relation to the European Court of Human Rights case law, in relation to sort of adoption and adoption orders, and care orders in relation to S20 accommodation and long-term accommodation as well. So yeah, we always recommend reading our legal notes to get a good understanding of what's been going on in the case law and how that might relate to practice for social workers. So great issue.
Yeah, and the good thing is, if you are too busy to read the articles, we already recorded one podcast and there will be another. So 2 of the articles will be covered in podcasts and you can listen on your way to work.
Absolutely, absolutely. As and when you do want to read the articles, remember that you can access them from the Core and Bath website, so resources, and then you go to the journal's homepage, and any link that you click to the journal basically will divert you through the sort of sign-in page for the members area, so you can access the papers there. But we've got quite a bit of open access content this time as well. I think a few of our articles you don't need to sign in to read. So that's probably it from us for now, isn't it? Thanks for joining us. See you soon.
Thank you. Bye.